Your decision to proceed with a knee replacement is based on your underlying diagnosis, how that arthritic knee is affecting your quality of life. At the point when you get to decreased lifestyle, increased pain, your decreased ability to get through your daily activities, and you've failed conservative measures, at that point in time, we would have a discussion regarding knee replacement. I think it's important to note that a lot of patients feel like knee replacement is sort of the end of the road or it's a last resort. And I think in today's world, you realize that it's the core operative thing we can do to give you that active lifestyle back. The days before, when you wanted to wait as long as possible, and it was a week in the hospital, and it was time in a nursing home, those days are gone. Knee replacement is cutting edge, it's exciting, and you don't have to wait for it anymore.